You look today at some of the more common terms used in anatomy and physiology. One of the important things about the first chapter of an anatomy book is that it'll largely teach you a lot of the language of anatomy and physiology. So you'll see a lot of these terms used in future chapters, so don't underestimate their importance. If you learn them in chapter 1, it'll make the future chapters a whole lot easier. But before we get into all these directional terms and other things, let's first mention something called the anatomical position. Now, this is a body position you always consider a person to be in when you use these directional terms. So you got to remember, it doesn't matter how a person has their body. You always consider them to be in this anatomic position when you use these directional terms. Now, the body needs to be nice and straight, right? You don't have to be standing. A person can be lying down on their back. They can be hanging upside down from their feet, whatever. It wouldn't matter. But make sure the body's nice and straight as possible. You're facing forward. Your feet are together. Palms are facing forward, right? A lot of time we hang our upper limbs at our sides. We put those palms to the back, but they want to be forward in this position. Don't forget that. Mouth closed, upper and lower limbs are against the body. In other words, you pull them in close as you can. Now, some of these other body positions you hear along with this might be some others like supine and prone. Usually you hear these words supine and prone when you hear about a person lying face upward or downward. But another time you might hear is with the palm of the hands. Palms up or palm down. So always think of supine being up and prone being down. The entire body or the palms right there. But look at some of these other directional terms like superior and inferior. You can see in parentheses some other terms you might see used as synonyms, but you'll pretty much always see and hear superior and inferior. Now, these are a couple of commonly misunderstood directional terms. Superior does not mean up, and inferior does not mean down. Superior means closer to the top of the head, and inferior means further away from it. So anytime you're moving closer towards the top of the head, you're moving in a superior direction. Say if you were to start at the top of the head or anywhere else along the body and move away from the top of the head, you're going inferior. And remember again, this is not up and down. Think of a person, say, is lying down on a table flat on their back. Again, superior is not going to be up, but it will always be towards the top of their head. Inferior, of course, is in just exactly the opposite direction. And often where you hear these terms used throughout the book is to describe one body part in relation to another. So let's say you've got two body parts. Let's say your mouth and your nose. Now look at those two things on your face and ask yourself which one is superior to the other one and which one is inferior. Again, superior is closer to the top of the head. So if you look at your mouth and nose, well, which one's closer to the top of the head? Your nose. So that's why your nose can be described as being superior to your mouth because it's closer to the top of the head. Inferior, again, away from it. Your mouth is inferior to your nose because it's further away from the top of the head. So that's often how you see these used throughout the book. Next here we have medial and lateral. Imagine, again, you're always in this anatomic position, that somebody were to draw a line right down the center of your body from top to bottom. In other words, they started at the top of your head and just drew a line right down the very center of you, right down the middle of your forehead, your nose, your mouth, and so on down the body. If you were to start out left or right, say out by your left hand, right hand, whatever, and move towards that midline, wouldn't matter from which direction, left or right, if you're moving towards the very center of the body, that's a medial direction. But let's say you start at the very center. Most people know where their sternum or breastbone is at. And you were to move out to the left or right. Well, that's going laterally. So you go lateral left, lateral right, whatever you want. It's closer to the center line, further out away from it to the left or right. After that, we have proximal and distal. Think of these as closer to the beginning or further away from the beginning. Now, often when you hear these two terms used is on the upper and lower limbs. Look at an upper limb, right? We're not going to call that an arm anymore. We're going to call that an upper limb. Let's say you look at this area at your shoulder, your elbow, your wrist, your hand, your fingers, and so on. Well, let's say you're comparing any of these two body parts. Think about your shoulder compared to your hand. Well, since your shoulder is closer to the beginning of your upper limb is considered at your shoulder, just like at your lower, it's considered at your hip. Since your elbow's closer to the beginning where the upper limb starts and what, say, your hand is, your elbow's proximal to the hand. You can look at this in the opposite direction. What is your hand compared to your elbow? Well, your hand's further away from the beginning of your upper limb, which again is at your shoulder. So your hand is distal to your elbow. But let's say you were to start at your fingers and you're moving towards your elbow and shoulder. That's going in a proximal direction. You start at your shoulder, elbow, wrist, whatever, and you're going towards your fingers. That's in a distal direction. So again, usually you hear those on the upper and lower limbs. But another time you might hear this being used is with something like, let's say, the digestive system. It starts at your oral cavity and goes from there to your pharynx, which is your throat, and then down to your esophagus, towards your stomach, and so on down the line. Any structure that's closer to the beginning of that system, say at your oral cavity, is considered proximal, and anything further along through the system is distal. So there are ways you might see those terms being used. Here's a couple others, superficial and deep. Superficial is closer to the surface of the body, and deep is further away from it. So let's say you compare two things like your heart and your ribs. Well, your heart is obviously deeper inside of your body when you compare it to the ribs. So the ribs are superficial in comparison to your heart. But say you compare your ribs and your skin. Well, your ribs are deeper. They're further from the surface than what your skin is. So the ribs are deep to the skin. It just always matters what two things you're comparing. One of them's further from the surface, call it deep to the other thing. Something's closer to the surface, call it superficial. Look at more and more examples of all these throughout your book and they'll make sense. And next down here we have anterior and posterior, sometimes called ventral and dorsal. Anterior is closer to the front of your body, posterior is closer to the back. And one way you can sometimes remember which one is which is, remember, if you ever see shows about sharks, usually the first thing you see is the dorsal fin on that shark coming out of the water. And where's that dorsal fin at? On their back, which is posterior. So remember that posterior or dorsal is to the back side of them. The anterior ventral is to the front. Something's closer to the front, it's anterior to something else. Something else is further to the back, it'd be posterior or dorsal. And here if we look at this little skeleton right here and think about some of our terms, again, we could be moving in a superior or inferior direction. Again, that's not up or down. The skeleton, we're lying flat on a table. Anytime you're going towards the top of their head, that's superior. And again, inferior is away from it. Medial. Now again, for this medial and lateral, imagine there's a line right down the very center of your body. So if you were to start, say, at your sternum and move out to one side or the other, wouldn't matter which direction, that's going lateral. But if you start out here to the side, move towards that imaginary line, you're moving in a medial direction. After that, we got proximal and distal. Again, say you're looking at upper and lower limbs, and this time let's look at the lower limb. Your lower limbs start right here at your hip. So that's the proximal area where they begin. You start there and move away from where it begins, that's distal. And if you're moving back towards where it begins, that's proximal. Again, sometimes you'll see that proximal and distal used on body systems too. Anterior and posterior. If we were to start at the back of this guy, say where his spine is at, and move towards his sternum, you're moving towards the front, anterior. You were to start at his sternum and go back towards his spine, that would be in a posterior direction. And then again, superficial or deep. Imagine something like your heart or lungs inside this thoracic cavity here. Well, they're further away from the surface than what something like these bones here that you see. So they're deep to these bones. The bones are closer to the surface when compared to the heart and lungs, so they're superficial to them right there. And also look at these body regions. If you'll learn these body regions in Chapter 1, it'll make future chapters so much easier because so many structures of the body are named by body regions, where there's arteries, veins, nerves, muscles, whatever that may be, you'll see a lot of it. So look at some of these regions in the head and neck. Frontal, think of that as your forehead. Some of these are easy, like orbital for your eye, nasal for your nose, oral for your mouth. We use a lot of those words. Otic or otic for your ear, buccal for your cheeks, mental for your chin, cranial for your skull, occipital for the back of your neck, and cervical for the neck itself. Looking at your chest and back, Clavicular, the collarbone, right? You may have heard of that little collarbone before, right up sort of the top of each side of your chest, left and right. The acromial regions outside of your shoulder. If you put your hand on the very outside of your shoulder, way up high there at your shoulder blade, outside to the top, there's an acromial process there. When we get to that bone further down the line, you'll see that structure there. It's named by that region. Scapula for your shoulder blade. That's the scapular region. Pectoral for your chest. You probably heard like the pectoralis major muscles, big muscles in that area. Sternal for the breastbone or sternum. Mammary for the chest. Abdominal for your stomach. Vertebral for the spine. Lumbar for your lower back. Umbilical for the navel region. Looking at your upper limb, let's start out at the fingers. Those are the digits, so that's the digital region. Palmar for the palm of your hand, those are easy ones there. Carpal for the wrist, you'll see there are 8 carpal bones there in a future video. Antebrachial for the forearm. Antecubital for the front of your elbow. Brachial for elbow to shoulder. Now, a lot of times people think of arm as being all of their upper limb. Not now. That is just part of an upper limb. So that brachial or arm region is just that area from your elbow to shoulder. If you want to say shoulder to elbow, that's fine too. Axillary, up under your arm and your armpit. Olecranon, that is the tip of your elbow. It's a piece there called the olecranon process, part of the ulna bone. Lower limb, again, go down to the toes. You got digits or digital region, just like you had with fingers, no different. Talus for the ankle, pedal for foot, crural or leg. Now again, a lot of people want to call their lower limb a leg. Not anymore. Leg or crural regions, just part of the lower limb. If you want to say the region from your ankle to your knee or knee to ankle, either way, that's fine. Sural for your calf region, patellar for your kneecap, that's the patella bone there. Femoral is knee to hip. Probably heard of the big old femur bone in that region right there. Popliteal is the back of your knee, so that's that back side there where it bends. Gluteal for the buttocks region, pubic for the genital, and inguinal for the groin. And here again, the links to the Amazon study guides if you need one of those.